Hi, my name's Caitlin Darnulc, and I did an article on managers and how their duty to maintain good communication in a hospital. Um, the first one it talked about is professional duty, and just, I guess, the managers being professional, being able to listen, not snapping back, not taking anything too lightly, being serious, but also involving their other nurses in the workplace. They need to respond warmly and positively so that other nurses take them serious but know they're also professional about it. Communicate effective. If they're trying to get their point apart, you're not communicating effectively in a hospital, it can go extremely bad. Especially when you're dealing with medical situations, your nurses should feel comfortable around their managers. Poor relationship between the staff can become a legal issue. It said that failure to communicate effectively can also have legal repercussions. If you're not communicating, you don't know, telling a nurse to go in that room, they don't know anything about that patient, or if they give them wrong medicine, anything can happen, and then they can end up suing the hospital. So communication is probably the biggest key to all the nurses, the nurse-patient, doctor-nurses, anything. Those managers really need to point out that communication is the most important thing for a nurse-patient relationship. It also said promoting good communication, having policies and procedures available so they understand, so your nurses understand how to communicate effectively in the hospital. And it said a competent staff is required. It talked about competence a lot and how important that is in a hospital. And just effective communication systems. Once again, really having their nurses understand their systems and their way of communicating to each other so nothing gets confused, nothing goes bad, no one ends up making the patients worse than they already are. They're also talking about role modeling and how the managers are such a role model to other nurses. And it said they're responsible, nurses or the managers are responsible for the changes in procedures, so they really need to kind of take a role model position. They are above the other nurses, so they really need to make them feel like they are role models. They can look up to them, they can ask them anything. Communication, they really need to be able to feel comfortable around them. And if they feel like role models and they treat their other nurses just fairly and nicely, they're going to look at them as role models, and that's someone who they're going to want to be like and how they're going to want to act like. Conflict management, it also talked about just result of inadequate communication, ethical decision making, errors in poor care. There's just a million things that can go wrong and so many conflicts that can arise from not communicating well. Nurses and managers must be able to feel free to speak out if they feel like something is going wrong, if there's if there's not ethical things going on, just safe, fair, acceptable. And also self-awareness. The nurses and the managers really need to know how they're communicating. They really need to be aware of how they're communicating, because they could end up being the problem. Some people just think, well, I'm not the problem, but you actually could be the problem of a lot of the communication. And they just don't know it because they really don't kind of put in their head oh, I could be doing something wrong. Maybe your communication skills aren't as good as what you really think. So the article was really just about just how important communication is. Like in the workplace, I know the class, it's all pretty much talks about, but a hospital I felt like was probably the most important place communication needs to be. I would worry if the nurses weren't good at communicating with each other, with their managers, with their doctors, or with their patients. You have to be able to feel comfortable in a hospital, and if there's not good communication, no one is going to feel comfortable. There could be so many things go wrong in a hospital if there's not good communication. There could be, to help that, there could be education. Really, I'm sure people think they know how to communicate, but they may not. And if you have just education seminars, just something extra to really help them understand communication a whole lot better. Just open management style. Really, the nurses need to feel like they can go talk to their managers. If they don't feel like they can't talk to their managers, that means there's not good communication going on. ensure that everyone is valuable. The nurses need to make um, their other nurses, the managers need to make their nurses feel that they're valuable to the hospital, that they're doing something good. If they don't feel valuable, they're not going to work hard, they're not going to communicate well. And just the nurse managers need to make themselves feel available. They need to make sure they're available for all of their nurses. If you don't feel like your manager is ever available for you to talk to or get advice to, it can go extremely bad. Just listen to the other nurses. Really, if you have, just information, help each other with information, deal with conflicts. Just communication is just so important in a hospital. And that's why I picked this article. I thought this article was a great example of how communication really could go wrong and how it is important in a workplace.